Media Briefing. At this time, all participants are in the listen-only mode. After the speaker's presentation, there will be a question and answer session. To ask a question during the session, you will need to press star one on your telephone. So please be advised that today's conference is being recorded. If you require any further assistance, please press star zero. I would now like to hand the conference over to your first speaker today, Michael Schomer. You may begin.
Thank you for joining us for the COVID-19 media briefing for July 28th. We'll start today with opening comments from Health Commissioner Jen Malcolm and Education Commissioner Dr. Heather Mueller. We also have MDH Infectious Disease Director Chris Ersman on the line with us today. After those opening comments, we'll take questions from reporters on the line. With that, we'll now turn it over to Commissioner Malcolm.
Thank you, Mike. Good afternoon, everyone. Thanks for joining us again today. We wanted to take this opportunity to discuss in more detail the recommendations that we've just rolled out today. As CDC updated their guidance just yesterday, we wanted to get our recommendations strongly endorsing the CDC guidance out as soon as we could. I very much appreciate my colleague, Commissioner Mueller, joining us for today's call, and we're going to hear from her in just a moment. I know we talked a lot about kind of case trends just on our call on Monday, but it bears repeating some of the trends because that really does set the context for CDC's updated guidance and our Minnesota endorsement of that guidance. We reported another 625 COVID-19 cases today, so we're continuing to see a sharp increase in our state, which kind of mirrors the trends across the country. And more evidence is mounting that the Delta variant is a very different and more challenging virus than the original strain. In Minnesota, we last saw daily counts this high on May 20th, almost 10 weeks ago. In the last week, we've reported just under 2,800 new cases, a 72% increase over the number reported just the week prior. And the speed of case growth is truly concerning. Overall case growth rates are more than double what we saw a month ago. And each week, the week-over-week changes are increasing. And this increase is in the context of relatively stable testing rates over the past few weeks. The additional cases reported today puts us at a new cumulative total of 611,458 laboratory confirmed cases since the start of the pandemic. As of yesterday, an average of 25 people each day over the past week have been admitted to the hospital. This is more than double the average number of people admitted each day as recently as the week leading up to July 4th. Over the past 4 weeks, we're seeing a pretty consistent about 12% week-over-week increase in the hospitalization rate. And concerningly, the overall percentage of COVID cases which are ending up needing to be hospitalized in the last 2 months is 9.3% of all those cases, which is more than double the rate of cases being hospitalized that we saw during our highest peak in November and December of 2020, when we were seeing 4.5% of cases needing hospitalization. Adding to this concern, in the most vulnerable zip codes, as measured by the Social Vulnerability Index we've discussed in the past, so in the first quartile, the most vulnerable zip codes, hospitalization rates are increasing even more quickly than the statewide trend. In the first quartile of SVI zip codes, hospital admissions are 72% higher than they were a month ago, compared to the 41% higher statewide rate over the same time period. And unfortunately, we know from past trends that these disparities in severe illness, the hospitalized cases, translate to mortality inequities as well. There were 4 deaths in our latest data report, meaning that we are now at a cumulative total of 7,660 Minnesotans lost to COVID-19 since the start of the pandemic. Today, we're here to discuss, and joined by our colleagues at the Minnesota Department of Education, the updated recommendations from the CDC, and that we at the state level are strongly recommending that schools follow that CDC best practice guidance for preventing the spread of COVID-19 in our K-12 schools this fall. These best practice recommendations from the CDC reflect the current state of the pandemic, which is evolving rather quickly, as well as the fundamental importance of in-person learning for our students. Students, families, and K-12 educators are preparing now, of course, for the start of the 21-22 school year. And I don't want to miss saying that we are in a much better place than we were last year, thanks to the millions of Minnesotans who have stepped up to get vaccinated. And that is a critical difference. But it's very clear that we are not done with the pandemic yet. Many Minnesotans remain unprotected, including all of those under age 12. That is a big concern, especially with the emergence of the extremely infectious Delta variant. Given the ongoing pandemic challenge at hand and the importance of giving our students the best opportunity for in-person learning, we really need to use all the tools available to us to prevent the spread. That's why the guidance document we put forth just recently reflects CDC's recommendations for implementing what is called layered prevention strategies. This means using multiple prevention strategies together to provide the best protection. Proactive COVID-19 prevention strategies, not just reacting after it happens, but trying to prevent the spread, is critical to protect people, including students, teachers, and staff who are not fully vaccinated or who have certain medical conditions, especially in areas of moderate to high community transmission. While there are no longer mandates that schools follow this guidance represents the most current science-based best practices for safe in-person learning. These recommendations are designed to support local school boards and school leaders as they are implementing health and safety practices for the upcoming school year, and to help Minnesota students get back in the classroom safely and keep them there. These best practice recommendations provide a framework for local schools to help safeguard in-person learning. Key points of the guidance include these. All people ages 12 years and older should get vaccinated for COVID-19 before returning to in-person school, sports, or other activities to protect themselves and also to protect the people around them who cannot get vaccinated. You can talk to a healthcare provider or find vaccine locations near you by checking the website. All students, teachers, staff, and visitors in school buildings should wear masks indoors, regardless of vaccination status. Again, this was an update that the CDC made just yesterday based on emerging and accumulating data on the Delta variant. Schools should maintain at least 3 feet of physical distance between students within classrooms whenever that's possible. And when it's not possible to maintain 3 feet of distance between students, it's especially important to layer other prevention strategies. As always, students and teachers and staff should stay home if they are feeling sick and should contact a healthcare provider for testing and care. Students, teachers, and staff who have not been fully vaccinated should stay home if they have had recent close contact with a confirmed case and get tested. Students, teachers, and staff who have been fully vaccinated do not need to stay home if they've had recent close contact with a confirmed case, so long as they remain asymptomatic and do not test positive. CDC also has testing guidance for anyone exposed to a confirmed case. People who are not fully vaccinated and are returning to in-person school, sports, or extracurricular activities and their families should get tested regularly for COVID-19, according to CDC guidance, again, especially as we are seeing increased spread. And schools should encourage ventilation, contact tracing, in combination with isolation and quarantine, hand washing, respiratory etiquette, cleaning and disinfection practices as important added layers of prevention. As we've said many times now, the Delta variant is proving to have an alarming ability to spread more easily. So it's more important than ever that anyone eligible for vaccination get that protection as soon as possible and follow the CDC's guidance for continued masking, distancing, and other prevention strategies to help avoid the widespread illnesses and community impacts we saw during the last school year. These proactive COVID-19 prevention strategies remain critical to protect people, again, including students, teachers, and staff who are not fully vaccinated or who have certain medical conditions. At this time, The Pfizer COVID-19 vaccine is the only one of the 3 vaccines that has been authorized for use by people ages 12 and older. The data from the Pfizer vaccine studies show that the vaccine is safe and effective for this age group. CDC shared some really critical data yesterday, along with issuing their new guidance. If you get vaccinated, your risk of getting infected by the SARS-CoV-2 virus is 3.5 times lower than if you are not vaccinated. But your risk of getting seriously ill from COVID is over 8 times lower. And your risk of hospitalization or death is 25 times lower than if you are not vaccinated. Pretty good odds. There are many, many options in Minnesota to get vaccinated. For more information on how to do that, visit vaccines.gov or talk to your healthcare provider. We do have that map, find vaccine locations still on our website. This allows you to see which providers are offering which COVID-19 vaccines. And of course, you can also make a COVID-19 vaccine appointment or walk in at many pharmacies, making appointments at clinics and hospitals, signing up for events sponsored by local public health departments or community groups near you. Our kids deserve a worry-free, safe, and fun fall back in the classroom, including participating in sports and doing activities with friends. And taking easy preventive measures like getting vaccinated will help ensure that they can do just that and be kids again. And now I'm pleased to introduce Dr. Commissioner Mueller and ask her to share her thoughts on the CDC guidance and what we have rolled out together today. Commissioner Mueller.
Thank you. Thank you, Commissioner Malcolm, and thank you everyone for joining the call. This information is incredibly important to our Minnesota families and everyone in our school communities, and I'm thankful to be able to join Commissioner Malcolm and the Department of Health to share these recommendations. The recommendations from the CDC really support our local leaders and our school boards as they make decisions that fit with the needs of their community and protect the health and safety of everyone in their school buildings. These recommendations, as we said, will help our local school boards as well as our school leaders keep our students safely learning in person, which continues to be our top priority. Over the course of the pandemic, we have seen just how different the situation can look from community to community, and these recommendations build on the targeted approach that we've taken throughout this past year. All of us know that the last school year was challenging not only for our students, but for our families, our educators, our school staff, and others in our communities who continue to support our students each and every day. As the wife of a middle school math teacher and a mom of 2, I saw firsthand how difficult this could be. Throughout the pandemic, we have prioritized safe in-person learning, and heading into this fall, we're grateful that it's going to look a little bit more like what we're used to. We also know that in order to keep our students, our staff, and our families healthy and safe, certain measures like masks, social distancing, and good hand hygiene are going to continue to be really important. As we've said throughout the pandemic, the situation continues to evolve, and we will continue partnering with Commissioner Malcolm and the other experts at the Minnesota Department of Health to monitor the virus around the state as we navigate the upcoming school year. I also want to take a moment to echo Commissioner Malcolm's words about the importance of vaccination for all who are eligible. Our youngest Minnesotans are not yet eligible for vaccines, so it is critical that those of us who are able to get a vaccine do so. Vaccines give us the very best possible opportunity of making sure that our students have the school year that they deserve. Throughout the summer, we have seen our students participate in some of the hands-on activities and learning experiences that they may have missed out on last year, and I'm excited to see that continue into this fall. I'm incredibly grateful to our families, our educators, our school staff, and our school leaders for continuing to prioritize the health, safety, and wellness of our school communities while making sure that our students get to have the school experiences that we all want them to have. And with that, I will pass it back to Mike.
Thank you, Commissioner Mueller. Operator, we're ready to take questions.
Okay, as a reminder, ladies and gentlemen, to ask a question, you will need to press *1 on your telephone. To withdraw a question, press the # key. Please stand by while we compile the Q&A roster. Okay, first question, we have Matt Sepik with Minnesota Public Radio. Line is open.
Hi, Commissioner. I am wondering when and if there are outbreaks and upticks in COVID cases in localized areas, will decisions about closing schools be left to local school leaders, or will the state, will the governor, MDH, will they have more of a say about schools potentially closing if necessary because of outbreaks?
This is Commissioner Malcolm, and certainly invite Commissioner Mueller to speak to this too. And Chris Erzman is on, and so Chris, please do chime in if you would like to add something. One of the, we've talked a lot about the fact that this is best practice guidance. There are a couple of rules that do continue to pertain. One is the federal requirement that masking is universal on public transportation, including school buses. So that remains a federal requirement. And in Minnesota, we have a disease reporting rule that requires all positive cases of COVID-19 to be reported to MDH so that we can help keep track of things like clusters and outbreaks. And as we have done in the past with other infectious diseases, we will certainly consult with schools, advise them on best ways to respond to any clusters that we find. But that is not a school closure kind of mandate situation.
And this is Commissioner Mueller, and I would just chime in and say that I completely agree with Commissioner Malcolm, and we're going to continue to support our Department of Health as they partner and engage with our school leaders and local school boards as they are monitoring the data and making decisions about how best to navigate this in their schools and in their communities. And that will continue to be a local decision.
So the state, in other words, cannot force a school or a district to close because of a COVID outbreak. Does the state not have the power to do that, or is that a decision you're making for other reasons?
I invite Chris to chime in if she has such a deeper history on this issue than I do. But I think that,
Sure.
As you know, go ahead, Chris, you chime in.
Oh, I was just going to say that just by way of background, typically when we have situations like this in a school setting, we make recommendations that are fairly specific to the type of exposure. So you may have a situation in which it's a particular classroom or things like that, and we'll guide the school leadership in, how to address who needs to stay home because, to isolate because they're ill, who perhaps needs to stay home because they were exposed. But I can tell you that historically, even with influenza and other diseases, we really have never been in a position where we've recommended school closure. Typically, a school makes that decision because of staffing or because they have a number of students who are out and it just doesn't make sense to continue. But that is not something that we have historically done. There have been other ways that we can be more targeted in our mitigation.
Great, thanks.
Okay, next question. We have the line of David Orrick with Pioneer Press. The line is open.
Hi, guys. I was wondering if you could discuss the recommendation regarding vaccinated people still needing to wear masks. I'm assuming this is based on recent data and anecdotes coming out about breakthrough infections, but I'm questioning about how good that data is since the CDC is not even actually tracking breakthrough infections.
Well, I'll certainly invite Chris to speak to that last point, but yes, so there were two major things that the CDC said yesterday. This school guidance, which is universal masking, regardless of vaccination status in all communities, regardless of localized transmission rates in all K-12 schools. So that was a very inclusive recommendation. And again, based on the fact that those under 12 are not eligible for vaccination, and only nationwide less than 30% of all kids over 12 are vaccinated. So very, very large susceptible population in the schools. And in terms of the tracking breakthrough cases, I do believe that that the feds are tracking breakthrough numbers and studying that closely. And while the data that CDC has been compiling, and this is really, it's been accumulating in very recent days. While these aren't peer-reviewed studies yet, the CDC director has said quite widely that there's just sort of a confluence of evidence from other countries, from the data that we do have, observational studies that suggest that this Delta variant just has some very different characteristics, even as it affects vaccinated people, and that's what led to this recommendation. But Chris, what can you sort of illuminate about what CDC is tracking?
Yeah, I think it's important to acknowledge, as you did, that CDC is tracking breakthrough illness. So they are collecting information on that. But in addition to what we're learning in the United States, they are looking at experience from other countries. And what we've seen with Delta, as the commissioner said, is it's really a different virus that's presenting itself differently than what we saw with the original or wild type. We are seeing that people who are infected with Delta have higher viral loads, meaning more virus in their body. And one of the things that's different with the Delta strain that is in contrast to the wild virus or the original virus, as well as Alpha or B117 that we saw earlier this year, is that fully vaccinated people who have a breakthrough illness might be infectious and could potentially spread the virus to others. That was not the case with Alpha. And so that is why they've made this new recommendation for masking for vaccinated persons, because we have new information based on how this Delta variant is acting that requires some changes in our guidance. And that's exactly how public health is supposed to work. We're supposed to continue to look at the data and the science and adapt our recommendations accordingly. And that's what CDC has done.
Okay, thanks. Just one quick clarification. You said the CDC is tracking breakthrough illnesses. You mean illnesses as in people got sick. They're not tracking breakthrough positive cases, though, are they? Am I misunderstanding?
Oh, they're tracking breakthrough cases in which someone is hospitalized. So they're tracking evidence of severe disease in breakthrough. In Minnesota, our observational data includes individuals who have just, an infection or disease. But CDC is focused on the more severe illness, but they are tracking breakthrough.
Okay, so Minnesota is tracking breakthrough positive infections. I mean, I know that Vault asks you if you're vaccinated when you submit your test.
Yeah, we don't, we're not, so correct. We are tracking breakthrough cases of COVID. So in other words, someone who has completed a vaccine series is 2 weeks past that vaccination and then develops a case of COVID. And we're not using it based on what we're hearing from, for instance, Vault and the questions that they ask, but we're looking at it based on the immunization data that we have on who's been vaccinated and then who's developed illness.
And have you seen an increase in those breakthrough positive cases in Minnesota since Delta has started to rise?
The number of, or the proportion of individuals vaccinated who've developed COVID has remained fairly consistent. In other words, 99.9% of people who've been vaccinated have not developed COVID. We'll continue to look to see if that changes over the next weeks. It certainly could as we see what Delta can do, but there is a bit of a lag. So I want to acknowledge that in the time between what we're able to glean from the data and what's happening on the ground. But at this point, we're still looking at a very strong vaccination effectiveness.
Thank you.
Yeah, absolutely. And this is Commissioner Malcolm. Again, I think, Dave, your question, though, does remind us to say that, obviously we can't know about every asymptomatic infection. If someone who's been vaccinated has been exposed, has no symptoms, but they've been exposed to the Delta variant, they may be completely asymptomatic. But as Chris said, some of this new data that CDC is looking at, some of the studies suggest that even in those cases, there may be a high enough viral load, even from an asymptomatic disease, to create some transmission risk. So that's, again, I just can't reinforce enough that the scientists at CDC are saying that these data are the science itself is changing very rapidly. It's a fluid situation, and the more we learn, the more focused we can be in these recommendations.
Next question, we have the line of Ashley Murphy with WCCO TV. The line is open.
Yes, thank you so much for taking my question. I have a question and a quick follow-up. First of all, if a student or a staff member does not want to wear a mask, will they be allowed to not wear the mask?
Commissioner Mueller, would you just speak to kind of how you're talking about that with the school officials?
Yes, absolutely. Thank you very much for the question, Esme. I think a couple of things that we know, because there are the strong recommendations that are coming out of the CDC as well as our Department of Health colleagues. I think it's important to note that is something that is a strong recommendation for our school boards and local school leaders to really think through. In the end, because it is a local decision, each of our school boards and school leaders will be making the decision about what that looks like for their school communities. And so not only will they be making a decision about masks or not masks, they will also be making the decisions about what that means for students or families who do not want to wear a mask if they have a masking policy. So that is something that will be decided at the local level.
Okay, so because Commissioner Malcolm mentioned, of course, there's no mandate. There's not a statewide mandate. But it seems, Commissioner Mueller, like what you're saying is that an individual school district could, in fact, create a mandate. Am I understanding that correctly?
That is correct. So there is not a mandate that is coming from the Department of Health or the Department of Education. Every school district, as you know, across the state makes local policies in school board policies, and they determine those either for legal reasons and also in partnership with their communities. And so school boards will be looking at whether or not they are going to be including a masking policy.
And again, a mandate. So an individual school district could mandate that masks have to be worn.
Yes, they could, but that will not be something that came from the Department of Health or the Department of Education.
Thank you very much.
Thank you.
Next question, we have the line of Rachel Mills with ABC6. The line is open.
Hi, thanks for taking my question. I'm just wondering if, looking not at schools but at a county level, if MDH is going to be taking any action based on that CDC data yesterday. I believe there were 14 counties in Minnesota where they are strongly recommending that people who are vaccinated should put their masks back on, just based on community transmission in those areas. So I'm wondering if you guys are taking any action based on that, whether that's just observing these areas more closely, or whether mandates could come back into play, or if you're just parroting their recommendations, or what your guys' stance is on that.
Well, yeah, I think this is Commissioner Malcolm. Again, this is all sort of in the context of the environment in which, just as is kind of traditional for public health, we make recommendations based on what we know, what the evidence tells us about the best ways to mitigate spread of disease or to prevent. So we will continue to do that along with our local public health partners, and we've been, and will continue to publish county level information regularly, and that is So we're looking at that data all the time. And so are our local officials and healthcare providers and so forth. So we'll just continue to highlight, as we have with our own statewide kind of risk measures that we've talked about from time to time, where we are in terms of the caution level and the high risk level, and advising, and this CDC guidance is quite helpful in that regard to say, you know, at these trigger points, it's a really good idea for local leaders to certainly encourage vaccination. I can't say often enough, that is the number one recommendation, even in the school context. Top recommendation for safe schools coming school year is for as many people as possible to get vaccinated. And that's true kind of community-wide. So continuing to really urge vaccination, and I just want to put in another plug for the time sensitivity here. We are now 5 weeks out from the start of school. That's about how long it takes to get full immunity from the Pfizer vaccine for those the 12 to 17-year-olds, and same with Moderna. Of course, the J&J is a shorter time period with just the one dose. But that's why we're kind of emphasizing do it now in order to have that full protection by the time school starts. But certainly, again, we will continue to make these recommendations, to share the data with locals and encourage them to think about increasing kind of community level protections as the conditions warrant.
Okay, so it would be up to the counties then if they wanted to reimpose mask mandates.
Yes, at this point in time, that would be a local governmental decision.
Okay, thank you.
Okay, next question from with Aaron Golden from Spark Tribune. Your line is open.
Yeah, hi. I was just wondering if you anticipate putting out any kind of similar updated guidance for either higher ed or early childhood or child care facilities.
Commissioner Malcolm here. It's a great observation. The CDC's guidance from yesterday was specific to K-12 settings, so that's why we wanted to get this out right away for K-12. We'll see if CDC has some updated guidance for early education and child care and for higher ed as well. We'll certainly stay tuned for that and continue to look at our own guidance as well. Chris, don't know if you would add anything to that.
Well, I would just say that, we have a team that has been working with our higher ed partners. And so they are continuing to work with them as they anticipate, the upcoming school year, and looking at, mitigation and how to encourage vaccination and all of those things. So as the commissioner said, we'll definitely be looking to see what the CDC's written guidance includes when it comes out. But we are working with these sectors already to help them address transmission and mitigation as they prepare for the upcoming school year.
Thank you.
Operator, we have time for one more question.
Okay, last question from Dave Ulrich with Pioneer Press.
Yes, hi. Looks like I get a twofer. Are you guys looking at creating any kind of a health emergency or discussing going back to a state of emergency anytime soon?
Dave, I think, certainly nothing to announce on that score at this point. I think we're back in a more familiar territory of just continuing to give the best health advice we can, and really trusting Minnesotans to ask their good questions, get their questions answered, and make good decisions for themselves and their loved ones. I think the governor has said many a time that we will remain very vigilant about this, and we know, and I think it goes without saying that this recent and significant surge in cases due to Delta has what was not. I mean, to some degree, it was expected because of just global trends of seeing spikes in other countries, but certainly not a welcome development by any means, and not particularly expected this quickly to emerge as it has just within the last couple of days and accelerating in recent days. So it's very early to be thinking about other policy measures, but as you are completely well aware, that whole context has changed with the ending of the peacetime emergency declaration and the emergency powers that came with that.
Thanks.
All right, that is all the time we have for today. We invite any reporters with additional questions to reach out to our office this afternoon. Have a good day, and we will be back again soon.